Hello everyone, I am Dr. Bhupesh Goyel and I am the head of department from UEM Jaipur, and I am looking the department for Bachelor of Physiotherapy and Bachelor of Occupational Therapy. So today we will learn in this video regarding what is physiotherapy, what is Bachelor of Physiotherapy course, what is the duration, and various things about how students can go through this course and take admission in this course. So we'll learn about physiotherapy and what is it. So to progress with introduction to physiotherapy, as you can see in a nutshell, if I can say, a person, as you can see in the slide, a person is lying down with a painful condition, and slowly and gradually we are rehabilitating that person to a joyful and healthy condition. That person comes to running condition, as you can see in the slide. Coming on to the next slide, physiotherapy. What is physiotherapy or physical therapy? Physio means physical agents. Physical agents means heat, cold, others, etc. And therapy is treating people. Therapy is treating people. So treatment of people through physical agents, and we are not involving medicines in this. So this is basically a treatment wherein we are giving a non-medicated treatment, thereby minimizing the side effects of all the medicines. Coming on to the next slide, physical therapy, that is a healthcare profession and is concerned with human function and movement, and WHO also gives a definition for this physiotherapy profession. WHO defines physiotherapy as physiotherapists assess, plans and implement rehabilitative programs that improve or restore human motor functions. So what do you mean by assess, plans and implement rehabilitative programs? We'll come to that later on. Just to go with the definition, maximize movement ability, relieve pain syndromes and treat or prevent physical challenges associated with injuries, diseases and other impairments. So I'll come to this, every word of it. Physical therapy is for the preservation, enhancement or restoration of movement and physical function impaired or threatened by disability, injury or disease that utilizes therapeutic exercise, physical modalities as massage and electrotherapy, assistive devices and patient education and training. So physiotherapy as a profession, it is a primary healthcare profession. It is equivalent to MBBS, BDS, BAMS or Ayurvedic, what you can say, BHMS again homeopathy and Unani. So it is a similar course in that way, and it is a 4.5 years degree course. So you can write doctor after completing this course with your name and a suffix PT after that. So doctor so and so with a suffix PT. This is basically called as BPT, Bachelor of Physiotherapy, and it has the requirement of the criteria of taking an admission is 12th pass PCB, that is physics, chemistry and biology. These are the mandatory subjects with minimum pass marks of 50%, and UEM Jaipur offers this course. So this is aimed at enhancing mobility, physical independence and quality of life of individuals. We focus on treating a variety of conditions, promoting health and well-being. So what does a physiotherapist studies? As I said, it is an equivalent course to MBBS, BDS and other courses which are there available in the market. So a physiotherapist studies all the subjects of MBBS, that is anatomy, physiology, biochemistry, pathology, microbiology, pharmacology. Then in third years we have all the medicine subjects like medical subjects like medicine, surgery, orthopedics, neurology. So it goes on, and in final year we have got the PT aspect or the physiotherapy aspect, physiotherapy treatment of these medical subjects. So in addition to these subjects, we have got physiotherapy subjects extra, that is exercise therapy, electrotherapy, biomechanics, kinesiology, etc. A physiotherapist also studies detailed physiotherapy treatment of all medical conditions in addition to their medical treatment. Coming to the clinical training and internships, physiotherapy education includes clinical internship that normally occurs towards the end of the course. During this time, the intern has to undergo rotatory training in different departments. So this is basically after 4 years, the 6 months time, that what I mentioned earlier, that is 4.5 years course. So that 6 months is mainly for the training purpose in the hospitals, wherein a rotatory internship in every department has to be done by the student, which is compulsory, which is mandatory. Okay. We have these clinical hospital tie-ups. Basically, we have Jaipur Hospital, Apollo Spectra Hospital, CKS Hospital Jaipur, Narayana Hrudayalaya Hospital Jaipur, CK Birla Hospital Jaipur, Manipal Hospitals, Fortis Hospital, Jeevan Rekha Hospital, BSM, Barala Hospital, and many more. So the training which is imparted to the students from first year onwards, first year we have around 7 days program for the students, and they go to the hospital for the orientation program, where in 7 days they see the working of the various departments and get oriented to the hospital. Second year we have got 1 month posting, and the posting is done in OPD of physiotherapy, that is outpatient department of physiotherapy, wherein they are exposed to the patient's treatment in terms of observation. They are not allowed to touch the patient, they are not allowed to talk to the patient, just observe what is going on in the OPD, how the treatments are carried on, how the assessment is going on, how the plans are planning is going on for the treatment of the patient. So what does a physiotherapist do? So when I said in the definition earlier that I'll be coming to each and every part, now this definition will be explained in each and every part. So what does a physiotherapist do? The physiotherapist diagnose, make decisions on the presenting problem, gives the treatment using education, exercise, electrotherapy, manual therapy, rehabilitate to achieve the best functional level. Now what is this? What is the diagnosis meaning? The meaning of diagnosis is when the patient arrives to your clinic or when the patient arrives to your chamber in an hospital, so what you have to do is welcome the patient and assess the patient after that. Assessment is a very important part. Assessment means taking each thing into consideration, what the patient says about the presenting complaint, what he has come for you, what he has come to you for, and the previous complaints what he had earlier in his life, that is called as medical history. So the entire assessment has to be taken by the physiotherapist, plan for the treatment, diagnose the condition, and then plan for the treatment and implement those things in the treatment. Coming on to the next slide, who are physiotherapists? You can say they are go-to health professionals, that is mental well-being and physical well-being of a patient will be taken care of by the physiotherapist. Accessible first-time health professionals, skilled in health promotion, injury prevention and patient management. So they are easily accessible, and you can go for the physiotherapy appointments, you can take that, and you need not need a reference for a physiotherapist to come to go to a physiotherapist, but you can have a direct communication with that person and take an appointment. So that is the meaning by first line health professionals. University trained in health sciences, intensive study of anatomy and physiology. So university is giving a very good training, and we have got many equipments in the laboratories, and it's the advanced laboratory setup what we have got in the university. So we give an intensive study of anatomy and physiology subjects. Excuse me. Who are physiotherapists? We are coming that to the next slide again. Is skilled in clinical reasoning. Then we have lifelong learners, committed to evidence-based decision making. All this is done by a physiotherapist. Licensed and regulated health professionals with a unique professional title. Only registered physiotherapists can provide physiotherapy services. We are registered under the Indian body, that is IAP, Indian Association of Physiotherapists, and you need to achieve a registration number, and then only you can practice in India. So what exactly do physiotherapists do? So mainly looking on to lifestyle diseases. Nowadays, as you can see, every person more or less is having higher blood pressure or hypertension after a certain age. Then most of the people, they are having a blood sugar level higher, which is called as diabetes, again hyperglycemia. So that again is a problem which can be taken care of by the physiotherapist. These are systemic illness, but of course body exercises, nutrition has a very great role to play in these, and your nutrition and physical fitness has to be taken care of by a physiotherapist, thereby taking care of these systemic illnesses. Other than these diseases, you have got neck pain, you have got cervical problems, you have got back pain, lumbar problems, you have got knee pain, that is osteoarthritis, and different conditions wherein you can see a physiotherapist has a very important role, thereby giving this branch a very vast scope, a very wide scope, and in every field, wherever you think a physiotherapist has a work to do. It can be medicine, it can be surgery, it can be neurology, it can be orthopedics, it can be gynecology, obstetrics, it can be fitness, it can be anything. So physiotherapist has a vast scope and a huge demand. Coming on to the next point, assesses, manages and treats a broad range of medical conditions, as I already said, from sprained ankles to strokes. Now sprained ankle is a very small thing, wherein you just sprain your ankle if you are not, if you meet with an accident or if you imbalance yourself, to a stroke thing, which is again a disorder wherein your one side of the body is paralyzed, right? So again, from the sprained ankles to the strokes, that means again you can say it's having a wide scope of patients wherein you can just go through with the treatment. Okay, so this is, next is relieves physical pain and help injuries. Okay, so relieves physical pain means what? Any kind of body pain, any kind of muscular pain, any kind of joint pain, any kind of pain in the body. It might be even cancer pain, that is treatable by physiotherapy. Excuse me. It increases mobility, builds strength, improves balance and enhances the cardiovascular performance. Okay, now coming on to the cardiac conditions, what we have to do is, in ICU, the patient, when the patient is received from the operation theatre or post-operatively or in an ICU, a patient is there, main problem is with the patient of a cardiac person, ailment is breathing. So breathing exercises are the main thing, and then the postural drainage, again a medical term what I am using, is done in those cardiac patients to relieve them of their heaviness in the chest and make them breathing easier and getting them to from the ICU to the wards. So that rehabilitation part entirely is done by the physiotherapist. And coming down to the discharge part, that is from the ward to their home, they are given a home program, and the advice and entire rehabilitation program again is done by the physiotherapist. Coming on to the next slide. So as I mentioned earlier, you can have cervical problems, which is again very common among the computer professionals or people who are very much addicted to the mobile use. Low back ache, again a very prevailed problem in the community. Knee pain, again it comes with age, it comes with any injury, it comes with any accidents. So again knee pain, osteoarthritis and various conditions of knees, arthroscopic surgeries, post arthroscopic surgeries, also we deal with the knee pain and knee discomfort. So you have different branches of physical therapy, what I have mentioned earlier, that is neurology, orthopedics, or called as musculoskeletal conditions. Then you have cardiorespiratory conditions, community based rehabilitation, that is CBR, and women's health. What conditions do physiotherapists treat in these medical conditions or in these branches? Neurological, to mention some of them, are developmental delay, that is in the pediatrics patient, in the patients who are having a delayed milestone in children who are having a birth history wherein they have oxygen deficiency, they suffer with developmental delay. Parkinson's disease, again a very rare disease, but a very important role of physiotherapist is there in this cure and maintenance of this disease so that this disease doesn't advances. Spinal cord injuries, cut injuries, then stroke, as I mentioned earlier, the paralysis of one side. Benefits, what you can get: improved balance, coordination, strength, flexibility and function in above mentioned conditions and other conditions also. Ability to manage daily tasks, reduce pain and improved mood. So as I said, if there is a physical well-being, mental well-being will automatically come. Coming to the next slide, in orthopedic conditions, back and neck pain, arthritis, osteoarthritis, various types of other arthritis, fractures or sprains, joint replacement surgeries, post joint replacement surgeries, sports injuries. Then benefits are decreased pain, improved joint mobility and strength, restored physical function and injury prevention, possibly prevent or delay. Coming to the next slide, what specific conditions do physiotherapists treat? Again in cardiorespiratory, as I mentioned earlier, ICU patients, chronic obstructive pulmonary diseases, cystic fibrosis, heart disease, respiratory infections, post surgical. These are some major conditions what I have mentioned here. It's not like this is only conditions what the physiotherapists treat. There is a variety of diseases what we treat. Then you have benefits of improved breathing and secretion clearance, reduced breathlessness and increased endurance, increased strength of arms and legs. These are some of the electrotherapy modalities that we treat with. IRR therapy, that is infrared, shortwave diathermy, microwave diathermy, electrical stimulation and wax therapy. These are again to mention some of the equipments. These are not the entire range of the equipments or the modalities what we treat with. Some of the exercises or the treatment part what we give are passive exercises, stretching exercises, strengthening exercises, mobilizing and breathing exercises as mentioned by me earlier. So now coming on to a new branch that is called as hydrotherapy. This is also called as aquatherapy, as this is an emerging branch, and it is mainly used for those people who are having difficulty in weight bearing. So paralysis people again who cannot weight bear, but the exercises are important for them. Again, arthritis patients wherein hip arthritis is one condition, knee arthritis is another condition, gouty arthritis wherein ankles are mainly involved. So again, when the patient is not able to weight bear, we cannot expect the patient to do the exercises on the ground. So we take the person to water, to the swimming pool with the safety devices on, with taking care, and the patient feels lighter. The patient doesn't become actually lighter, but the patient feels lighter, and that is because of the buoyancy or the hydrostatic force, what the upthrust force is given by the water to the body. So it makes a person, it makes for a patient easier the exercises to be continued and to get rehabilitated faster and to get cured faster. We have posture and ergonomic corrections for various people, mainly again for those people who are office goers and mainly sitting on the computer for longer period of time. As I mentioned earlier, for the pediatric cases we have got chest physiotherapy for newborn babies. There are a lot of secretions there in the lungs. For the adults also that is there. Different clients treated by a physical therapist. Those are pediatrics, geriatrics, athletes, regular adult population and the other patients. Okay. Now coming on to the career opportunities in this course. Career opportunities, a physiotherapist can work in multi-speciality hospitals, non-governmental organizations, geriatric or old age homes, rehabilitation centers. They can come in profession of teaching as we are. Private practice or clinic, very important, that can be done by a physiotherapist after 4.5 years degree course, BPT course. Centers for physically and mentally handicapped children. Then we have management studies, go for a management study, or a sports therapist. Again, this is very emerging branch, sports therapy. Every sport requires a sports therapist in that, contact sport or a non-contact sport, and they can go for research also. So if you talk of salary for the physiotherapist, it is in the government sector after bachelor's, you can start with a salary of 40,000 per month. But in the private sector, it ranges from 50,000 to up to your skills. Now, I have mentioned this word up to your skills. Maybe you may think of the doctors in your area, but you know only few of them, 4 or 5. You do not know the entire range, entire available doctors. Now, that is because 4 to 5 doctors are successful in their life. They have good skills, they have good knowledge, their results in the patients are good, and that's why they are popular. So again, the person who is popular is because of their skills and knowledge, and with the patient communication and with their results. So if the person is having a good communication skill, good skills, then good knowledge and good results with the patient, of course the person will be earning more than that. So that's why I have mentioned up to your skills. So now everybody might be have seen this movie, that is Dangal movie, isn't it? So in this, she is Kanupriya, and she is from Muzaffarnagar and she is a physio. So before this movie was planned, she was approached regarding physiotherapy for the entire movie film cast, which was required for their fitness, for their injuries, because again Dangal was a movie wherein it was a kind of contact sport wherein Kushti was there. So Dangal was there. So contact sport, the injuries were there. The film stars were prone to injury because they were not professional sports players. So again, you can see the pictures wherein different cases were treated by Dr. Kanupriya from Muzaffarnagar. Similarly, you had one movie coming on which came earlier, and in that Sonam Kapoor had played a physiotherapist. As a physiotherapist, she played a role. So if you can say, physiotherapist, again I said, has a very vast scope, and they have a new branch emerging, as I said, sports, MPT sports, wherein all the contact and non-contact sports requires a physiotherapy on field and off field. After the bachelor's, you can do masters of physiotherapy, that is MPG. Then you can do doctoral program, that is doctor of physiotherapy, and various PG diplomas are available in India. Masters of physiotherapy can be done in MPT neurology, MPT in cardiopulmonary rehabilitation, MPT in orthopedics, or also called as musculoskeletal, MPT in sports, MPT in community-based rehabilitation, MPT in pediatric rehabilitation. So all these branches are available with UEM Jaipur in our campus. These are to mention with some laboratories photographs. Entirely all the photographs could not be placed because of the space. So this is just a 10% of the laboratories what we are having. 90% has not been shown. That you can see when you come down to the university. Extracurricular activities which are involved in the university other than the studies, because syllabus is being covered by every university wherever you go. What extra we can give to the student? We have various medical camps conducted with the student in their area to make them popularize from the first year onwards. So various workshops are being conducted in the university so as to give maximum knowledge and skills to the student. Seminars are being conducted, conferences are being a regular part of the curriculum. Sports, inter-college sports and sports among the physiotherapy community. Then we conduct Physio Fest, and we conduct Physiotherapy Day celebrations on 8th of September, that is a Physiotherapy Day, World Physiotherapy Day, conduct regular picnics. So coming on to the medical camps. So this is the medical camp wherein it was a 2 days camp conducted by BPT department on 10th and 11th of February 2018, and in this around 550 patients, 557 patients were treated approximately in 2 days by all the students and staff of physiotherapy. Coming on to the next camp, that is medical camp of knee joint, and we were focusing mainly on osteoarthritis people. We were having around 237 patients in this camp for 2 days. Again, Colino knee brace was prescribed for those patients who were having a severe knee problem and who didn't want to go, or you can say they didn't had the capability, financial capabilities, or the body was not supporting due to various other ailments wherein they could not go for knee replacement. So we had advised them Colino knee brace. These are again some of the other camp photographs which are regularly being conducted. Coming on to the workshops and seminars, that is a regular practice what we do, and the student do not have to pay, the student doesn't have to pay the cost incurred by the workshop or seminar. It will be borne by the university. Somewhere it ranges around 1500 to 30,000 rupees per person, per student, wherein the university bears the cost and the student is free to take the workshop in the university. So this was a workshop conducted on dry needling and core strengthening basics. This was another workshop conducted in the university by Dr. Vishal Bharadwaj. He is an HOD in Artemis Hospital, Noida, and ICU management advanced level was taken on 21st February 2018. This was again another workshop taken by Dr. Jitendra Singh on Colino knee brace. This was another workshop again taken by Dr. Jitendra Singh on knee osteoarthritis and knee braces. Again an advanced workshop being conducted by again Dr. Deepshikha on dry needling. So again Dr. Deepshikha Beniwal, she was taking an advanced workshop on dry needling. From that was earlier was a basic one, this was an advanced one, and it was conducted on 2017 December. We had even international speakers in our university. She is Miss Roser Mulvils from Spain, and she took a seminar on community-based rehabilitation. So I would say physiotherapy keeps you moving. That is the thing what I have to say. But this being an emerging branch and this being a very popular branch among the patients, because now patients are being aware, patients are very aware of their conditions, and they just Google it and they find out what are the pain symptoms and what conditions they might be suffering with and what is the best treatment they can receive from the doctors. So as the awareness is prevailing among the patients are getting things in the knowledge. They don't want to go for the medicated treatments. They want to go with the treatments which are having no side effects, and that's is provided by physiotherapy, that is BPT professionals, that is Bachelor of Physiotherapy professionals, and Masters MPT professionals. So I would say ki this program is very beneficial for the people who wants to go, for the students, those who want to go for a medical career, and in case they are fighting for NEET, they do have BPT seats and a Bachelor of Physiotherapy seats entrance in the government sector through NEET, and if in private sector they want to go, there is no need of NEET entrance examination. We have only an entrance examination of our university, that is UEM JE, that is a common entrance exam, and you can get through that with the admission criteria of 12th PCB, that is Physics, Chemistry and Biology, with minimum 50% of marks. So I end the lecture with that.